The government has done a poor job, and I emphasize a poor job at educating if they feel that people need this vaccine so much. They have done a poor job of sensitizing people. They have done a poor job of explaining to them what are the risks and the benefits of having the vaccine. We live in a global community where word spreads very rapidly, and people are not ignorant to the fact that there are many side effects associated with the vaccine.
That was Dr. Diane Maloney, a senior resident in the Infectious Disease Internal Medicine Department. She was among the unvaccinated healthcare workers who were barred from entering the Georgetown Public Hospital Corporation because she could not present her vaccine card or a negative PCR test. Dr. Maloney, like the many other unvaccinated healthcare workers, made it clear that she does not intend to adhere to the measures, which she described as an act of force. Gerald Ford, a government medical officer, expressed similar sentiments and noted that forcing persons to take the vaccines is a violation of human rights.
Aim to bring the country to herd immunity. We're not opposed to anybody who wants to take this vaccine. But just as they have exercised their right to say they want to take this vaccine, we are using the same right to say that we don't want to take it, wherever the reason be. Some people got religious reasons, some people got health reasons, some people just don't trust the vaccine, some people got all kind of thing why they're taking the vaccine. We're saying we're not defending reasons, we defend the right of a person not to take it, and we're fully justified in our rights.
Ford argued that just as doctors are not allowed to administer any medication to a patient without their consent, the principles should be the same for healthcare workers. Moreover, he pointed out that if the workers are required to provide the negative PCR tests, they should not have to pay for it.
We're also saying that if the employer wants us to take tests every week or every 2 weeks, then according to the Occupational Safety and Health Law, they need to pay for the test. It's not our place to pay for the test. That's what the law says. So why are they asking us to pay for the test? They know very well that persons can't afford to take it, and that's why they're forcing people. They use it as a tactic to force people to go and take this test.
Exemptions from the measures outlined by the Gphc will only be made for those categories of people listed in the guidelines issued by the Chief Medical Officer, Dr. Narayan Singh. Those include pregnant and breastfeeding women, people who tested positive for COVID-19, people who received blood transfusions, and people with underlying conditions. Reporting for the newsroom, I am Shakima Day.